is Dr. Kiiyonna Jones. I'm owner and founder of Luxe Beauty and Wellness Boutique located in the Southern California area. And my channel is dedicated to nurse entrepreneurship, nurses who are trying to elevate themselves, jump into this beauty industry, and also relieve themselves of burnout, mentally, physically, and emotionally. And so today's topic is about aesthetic nursing. I have a lot of nurses who reach out to me asking me how to become an aesthetic nurse. They have a lot of different questions to ask. And so I decided to dedicate this video to helping you jump into the aesthetic nursing space. So there are a few things that I want to dive into today, but before I get started, go ahead and subscribe if you have not. And better yet, wait to the end. If it's enough value and you feel like it's worth it, go ahead and subscribe. But you can also share this with other nurses who may be interested in entrepreneurship or even aesthetics. So let's get into it. First thing is, and I have my little handy dandy notes right here on my laptop. So the first thing I want you to consider when, before you make the move, before you make any investment, before you do anything, I want you to think about what your ultimate goal is when you're considering becoming an injector. Is your ultimate goal to work as an employee, which a lot of nurses work as injectors and they work for amazing aesthetic practices and they do really well. And it definitely relieves them of the burnout. It definitely gives them a little more autonomy with their time. They're able to do more things that they enjoy. And in a lot of places, they make way more money than bedside nurses. That's not the case in California, but that is the case in a lot of other states. So think about what you want to do with this. Like, are you going to be an employee? Or are you looking to ultimately start your own aesthetic practice and be your own boss? That's the first thing you want to think about. The next thing you want to do is take into consideration where you are right now. Are you an RN? Are you a family nurse practitioner? Are you another type of APRN like CRNA or women's health psychiatric nurse practitioner? Where are you right now? And get a good understanding in your state what you are allowed to do. So if you are an RN, you know that you can't practice medicine without a medical director. So if you were considering entrepreneurship, you want to take that into consideration before you decide how you're going to navigate this journey. If you are a nurse practitioner, the question would be, are you in a full practice state? Are you in a restricted practice state or a reduced practice state? And then do you want to be on your own, like with your own business, or are you trying to work for someone else? And maybe in 3 to 5 years or 2 to 3 years, you want to go ahead and get your own business started. I would always start wherever you are. I would always start with the end in mind, because you can reverse engineer that back and decide what you should be doing right now. The next thing I want you to consider before we get into those 3 things you must consider is, what is your level of experience? Are you a new grad or are you like an experienced nurse? And if you're an experienced nurse, have you been in non-clinical capacity in your job, or have you been strictly clinical? If you are a new grad, starting your own business as a new grad nurse in aesthetics, I would not do that. I would not recommend that. And I don't know that you'd be able to find a medical director who would be able to support that, because your medical director is also one who wants to work with nurses who are able to be independent and who they can trust is going to be safe for the public. So if you are a new grad nurse, I would not recommend going straight into ownership, but you could potentially find a location that would train you and that will hire you as a new grad nurse. I know it's not easy. I'm not saying that it's easy, but that is something that you could definitely do. I have worked with people who they have been able to do that right out, but it has not been without, them going through a lot to try to get that job. So just know you can as a new grad, but it's not easy. It's going to require a lot of creativity on your part to make yourself more marketable, to supplement that lack of experience, because a lot of them want experience. So you have to think about your level, where you are, because before you enter into this, you want to make sure that you are strategic and not just, okay, I want to be an aesthetic nurse, I'm just going to go and do it. But you want to be fulfilled ultimately in the end. So you don't want to go from, if you're a seasoned nurse, working, being burnt out and tired, and then you veer off into this aesthetic space thinking that it's going to be all great when you haven't really figured out what great looks like for you in your current situation. So it is so important to consider those 3 things before you get off into it. So let's talk about the first thing I want you to know before you become an aesthetic nurse. One thing is a lot of locations really do want nurses to have 2 years of clinical experience. And it makes sense. I mean, even though it's not required, if you think about it from the perspective of a business owner, would you really want to have to train someone and get a new grad who really does not have any experience of even like basic injecting, even if it's not an art to the injection, that has done like subdermal injections and IM injections and, sub-Q injections? Would you want someone who has not really had a significant amount of experience in that? Not really. So you really want to consider, if it's not, I'm not one to push nurses to go to the bedside, but I do know that there is a place for it. And there are some valuable aspects of being at the bedside for sure. But if it's something that you don't want, just be willing to do other things and be creative to get your clinical experience, like maybe volunteering or maybe doing an internship. You may have to do it a little longer, which means that you won't be making like a lot of money if you get a paid internship. And if you don't get a paid internship, you won't be making any money at all. So be sure to take that into consideration that usually they want at least 2 years of clinical experience. And I'll just tell you a personal experience of mine. When I decided I was going to go into aesthetics, I was like, okay, I'm going to go and work for like a med spa or an aesthetic practice. I won't say that I was aggressive. I just kind of applied to a few jobs, maybe like 5 actually. And at this time I already had my PhD and I've been a nurse for forever. I still didn't get hired. I had different responses. One of them said that I was like overqualified. Another one said that I didn't have enough experience. And the bottom line is it's weird because they want you to have experience, but a lot of them will not give you the experience. So you're kind of in a conundrum because you have to keep on going and just kind of find a way to get in, like maybe, like I said, paid intern or free internship, or even see if you can network with people who can possibly put in a good word. It's not very easy, but once you're in there, it's really good. You can also start off, and I would start off in, if this is something, especially if I was a new grad, I would consider doing like outpatient surgery. A lot of times they're hiring and the door is not so jammed. Like you can most likely get in that way and they'll see that you've already been in a clinical setting. And then from there, you could segue into aesthetics. It'll be an easier transition. Not to mention you'll be working closely with a lot of doctors and nurses who could put in a good word for you in aesthetics. I feel like with me, they probably could tell that I was trying to get some experience so that I could, open my own practice. A nurse with as much experience as I had and the level of education I had, I'm sure they knew that my goals would have been ambitious, which is probably why none of them hired me. So you want to make sure you think about that and take that into consideration. The next thing is I need people to understand, and this is something that I'm asked often, you do not have to be certified, you guys, to be an aesthetic nurse. And I have done extensive research as a business owner, but also I coach nurses, RNs, and nurse practitioners and mentor them through the startup process for their aesthetic practice. So I actually have a boot camp. So I've spent a lot of time really researching this and understanding why, and, just thinking about it, being able to kind of put it in nursing terms. What I will tell you guys, think about, you have your CCRN, you have your PCU certification, you have your MedSurg certification, you have your ED certification, like all these different certifications that we could get in practice. You don't have to have your CCRN to work in ICU, right? You don't have to have your MedSurg certification to work in MedSurg, right? But it does look better. True. It does actually help because when you take those classes, it kind of gives you like more authority in your specialty. The same is true for these CANs, which is called Certified Aesthetic Nurse Specialist. Same is true for them. The only thing with the Certified Aesthetic Nurse Specialist is that you have to have worked 1,000 hours under a plastic surgeon, or a aesthetic physician. Like it's very specialized. You have to have worked 1,000 hours for them. You also, of course, have to be currently an RN. And then you have to have at least 2 years of nursing experience. So it's a lot, and there aren't a lot of nurses who are CAN certified, which could give you a little advantage, but the problem is you can't do it until you have the experience. And so you can't even apply for it. So you have to have worked in the specialty under those conditions before you can even sit for certification. So that's something to think about. Anything you do on your journey can be helpful, especially as you are growing in this space. So I am never one to take away from anything. I just feel like it's kind of like not a one size fits all. I feel like we have a lot of opportunity and people just take different routes. You just got to figure out what's best for you. So when it comes to cans, I just say, if it works for you, but just remember, you have to get some experience first before you can even sit for cans. The next thing is taking a Botox and fillers training. If you are considering becoming an aesthetic nurse, and if you know that you want to be employed by a med spa or aesthetic practice, you would want to make sure that you have taken your basic, at least in your beginner's aesthetic and Botox training. Now, I will say taking the basic Botox and fillers training does not guarantee you a foot in. And I can tell you, I've met with a lot of nurses, including myself. I think when I first started, I probably thought this too, that once you get certified, like, okay, you can go and apply and be like, hey, I'm certified. They don't care. Most cases, they don't care unless they're in desperate need. But at the same time, if they were going to consider you to work for them, they would want you to have taken some training, because there is a huge difference in working as an aesthetic nurse and working as a nurse. Like fundamentally, it's the same, but you got to understand in aesthetics, it's an art. So like you're learning how to create the face. You're learning how to compliment people. You have to think about different ethnicities, although most people all have two eyes, a nose, and a mouth. There is very, very much so a lot of variability, and we have to, that's going to take some time, right? So when you go to these trainings, just remember that, you may not be able to just take this training and start practicing. Now, if you're an APRN, an advanced practice nurse, who have full practice authority in your state, and they allow you to practice in the aesthetic space as an independent practitioner, you may be able to take that and then start working right away, versus someone who is either an advanced practice nurse in a restricted practice state or a registered nurse. You may not have that advantage. So you want to just think about that and take that into consideration, because you're not going to be, as an RN, you're not going to just be able to complete this training and start injecting if you don't have a medical director. That's illegal. It's actually the practice of medicine, so it's outside of your scope of practice. Versus if you are a nurse practitioner, you still need a collaborating physician in restricted practice states or states that do not allow you to practice independently under the aesthetic umbrella. So those are some things to think about. Those are the 3 things that I strongly recommend you think about, and also consider those pre-qualifications that I just talked to you guys about. If you guys have any questions or want me to talk a little bit more about a specific topic, please make sure you comment below. As always, I have in the caption how you can reach me, how you can join any of my boot camps, and then also how you can follow me on other platforms. Please make sure, if I gave you some value on this video, that you like and subscribe, and be sure to share it with some of your friends, because I know it's the talk at the station. I know people are talking at the nurses station about aesthetics, because it is like the cushy version, the cushy specialty of nursing. So I hope this video was able to add some value to you. See you soon.